Hi, I'm Heath McGowan. I'm one of the anatomy lecturing staff at Bundoora, and I endorse this clipboard product.
This clip is on the muscles and movements of the knee, as well as the locking and unlocking mechanism. So the knee is a modified hinge joint capable of flexion and extension. So flexion is caused by muscles which cross the knee joint posteriorly. These include the hamstrings. More laterally, we have the biceps femoris, long and short heads. Medially, we had that semimembranosus and semitendinosus. Now, semitendinosus was one of those muscles that attach to our pes anserinus, along with sartorius and gracilis. Popliteus, located posterior to the knee, is our key to the knee, and we have our calf muscles, our gastrocnemius muscles, medial and lateral heads. They cross the knee posteriorly too, so they're going to contribute to knee flexion. Anteriorly, we had our quadriceps muscles. These were in the anterior of the thigh. They cross the knee joint anteriorly and will cause extension. There are medial and lateral rotators of the knee. So the knee is a modified hinge joint, meaning that some rotation is possible. So active rotation is only possible when the knee is flexed. So lateral rotation is caused by muscles crossing the joint posterolaterally, biceps femoris. So if you palpate behind your knee, feel posterior, you can feel that there's two tendons crossing the knee medially, semimembranosus and semitendinosus, and one laterally. That's our biceps femoris. If you flex your knee and rotate your leg and foot laterally, you should be able to feel your biceps femoris tendons tense up a bit. Likewise, if you rotate medially with a flexed knee, you should feel these two medial tendons tighten up. So medial rotation is caused by muscles crossing the joint posteromedially. So these are our semimembranosus and semitendinosus, as well as gracilis and sartorius on that pes anserinus and that popliteus muscle. Pes anserinus was our goose's foot. So this resembles the foot of a bird. We have three tendons all meeting at a common spot. It's formed by the insertion of sartorius from our anterior thigh, gracilis from our medial thigh, and semitendinosus, a hamstring from our posterior thigh. We like to say as mnemonics, strong gin and tonic. You might also like to think of say grace before tea, and this helps us remember anterior sartorius, medial gracilis, posterior semitendinosus. The function is medial knee stability. Don't forget they're also crossing the knee posteriorly, so they will cause knee flexion. They're also going to contribute towards knee rotation. Locking the knee is a passive rotation. The closed pack position is in extension. So to lock the knee, the femur passively rotates medially on top of the tibia. This is because the lateral femoral condyle is smaller than the medial condyle. That means that the lateral condyle is going to finish rolling before the medial condyle. The medial condyle will continue to roll, and the femur is going to keep rolling and rolling towards the medial side. Have a look at the following demonstration for an example of how this works.
This demonstration shows how the difference in size of the medial and lateral condyles gives rise to the different amounts of roll and ends up giving us that medial rotation we see as we lock the knee. Beginning, we turn the smaller of our fruits until it reaches its stop point, which would normally be stopped by the meniscus, but in this case we've put a toothpick in. So starting and rolling, 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 rolling. Doing the same for the larger fruit as we roll it through its diameter.
Go banana!
We can see that we get a lot more rotation, and therefore the difference in size of our medial and lateral condyles will lead to a rotation in the knee.
So this is the locking mechanism of the knee. Once the knee's locked, it's minimal muscle activity required to maintain that. So think of standing up straight for long periods versus in a squat pose. It's a lot easier to stand up straight. Unlocking the knee is the opposite. The key to unlocking the knee, like all locks, we need a key, and the key is the popliteus muscle. So to lock the knee, the femur rotated medially. To unlock the knee, we need to use our muscle, so it's an active movement to rotate the femur back where it came from. So we rotate it laterally. This must occur before knee flexion is possible. Don't forget that these movements, so locking the knee, rotating the femur medially, are only relevant in a closed chain movement. If you were doing an open chain movement, the tibia might be the one rotating on the femur. For the nerve supply, at the knee we follow Hilton's law. So that states that the same nerve which innervates the joint will innervate the muscles across the joint, will innervate the blood vessels that supply the joint, and will innervate the skin over the joint. So the muscles at the joint in the anterior compartment, they were innervated by the femoral nerve. So the anterior knee will be innervated by our femoral nerve. Likewise, the skin over the anterior knee innervated by a branch of the femoral nerve. In the posterior compartment, we had the tibial nerve innervating these hamstrings. The posterior knee will be innervated by the tibial nerve. Likewise, the skin over the posterior knee should be innervated by the tibial nerve. In the medial compartment, that obturator nerve was innervating the adductors, so we'd also expect it to innervate the skin over the medial knee as well as the medial aspect of the knee joint itself. Articular branches, they're going to innervate bone, cartilage, ligaments, tendons, and muscles. Note that we have anastomoses around the knee. We have 5 genicular branches of the popliteal artery. We have the superior lateral genicular artery, the superior medial genicular artery, inferior medial genicular artery, and the inferior lateral genicular artery. We also have the middle genicular artery. So these form the periarticular genicular anastomoses, which is a network of vessels which surrounds the knee and provides circulation, which supplies blood to the knee during full knee flexion, which might otherwise kink that popliteal artery. So other contributors to the genicular anastomoses include the descending genicular artery. This is a branch of the femoral artery. The descending branch of the lateral circumflex artery. We also had the anterior tibial recurrent artery, which is a branch of the anterior tibial artery. So previously we looked at the rotation of the femur on the tibia during a closed chain knee extension. So this was a locking of the knee in a closed chain knee extension. I want you to describe the rotation of the bones we might expect to see in either the femur or the tibia during an open chain knee extension. Discuss your answers on the forums. Thank you very much.